In the next module, we're going to look at checking understanding through concept checking questions. It is very common for what's going on in a patient's head to be different than what the clinician thinks they actually understand. And so one way to verify is through concept checks. Notice the first time through, we just ask, do you understand? Everyone says yes. When we introduce the concept checks, we are asking targeted questions to make sure the patient understanding is really there. We can compare good and bad examples. We can ask them for examples, open-ended questions, and targeted questions to really see if those sticking points have been overcome. Okay, so today we're going to be talking about I statements, and for those of you who don't know, I'm just going to read you a brief introduction. Okay, so when you're in a conflict, you may have difficulty clearly articulating your situation without escalating the conflict. So using an I message or an assertive statement, these can help you state your concerns, feelings, and needs.
In this example, once again, we watch the facilitator read from a manual, and we don't know what patients are thinking or what they understand. Remember, just because someone tells you they get it doesn't mean they actually do. The facilitator must verify.
You're going to state an observation, connect it to a feeling, then a need, and what you hope the outcome can be, so your preference. All right? So do you understand what an I statement is now? Can an I statement start with you?
No.
Okay. Actually, it can if it's connected to an observation. Okay, and so this is why it's important. In the way learning works is people's brains start automatically looking for patterns, right? And so if patients are off to...
In this example, the facilitator checks for sticking points by asking targeted questions, eliciting examples or components of the topic. This will allow the facilitator to back up and clarify before patients continue down the wrong path.
So an example might be, when you come home late, I feel very anxious and insecure because I'm afraid you might leave, right? And so in this case, when you come home late, we're stating an observation as fact, right? Okay, do we use I statements in an attempt to get our way or change another person's behavior? No. Wonderful. No, they are designed to communicate our own feelings and needs. What are some of the compounds of a successfully created I statement?
A feeling, the hope for an outcome,
Okay.
maybe not the expectation of it.
Sure. Okay. There are two more. Keith.
A need and kind of an expectation or what I want.
Okay, well, yeah,
An outcome.
close. A hoped outcome necessarily, a preference, not necessarily.